prioritization with emergency department triage. Think of a situation in which you are in emergency department and you are assigned to different clients. There is shortage of manpower and there is rush of patients due to some big bus accidents. How would you prioritize the situation? Would you save women first or babies first? Would you prioritize old people first? What is the criteria for prioritization? We will study this in the current lecture on prioritization with emergency department triad. We can classify the cases in 3 groups: highest priority clients, urgent priority clients, and non-urgent clients. Emergent or highest priority clients. If the clients have chances of survival with nursing intervention and need some immediate attention, and if it is a life and death issue of care, such patients need the highest caring priority. So who would be the patient falling in highest priority of care? Patients with acute heart conditions such as myocardial infarction, stroke, clients with amputated limbs, acute chemical effect on eyes, acute respiratory attacks such as with asthma or any anaphylactic reaction, patients complaining of chest pain, burns, hypersensitive reactions, etc. Urgent or intermediate priority, or yellow zone. In this case, those clients who have non-life-threatening injuries are put. One rule is they have to get the medical service within 30 minutes to 120 minutes. Example of such cases are the patient with open fracture, wounds, and medium burns. Non-urgent or least priority, green zone. In this zone, those patients who do not have life-threatening complications and who have local injuries and can wait for 2 hours for a healthcare workers are put in. Examples of clients with such cases are muscle strain, ligament strain, and closed fracture, etc. Let me check your knowledge on this one. An emergency department nurse has to prioritize among different clients rushing into an emergency department due to a bus accident. Which of the following cases should you prioritize first if there is a serious lack of nurses in the facility? Client with amputated left leg. Client with open fracture of right ulnar bone. Client with laceration of the palm. Client with close fracture of the tibia. The question is about the first priority, so there must be only one answer. According to the emergency department triage, the patients who have life-threatening situation and need immediate attention are placed in emergent priority or highest priority care. So the correct answer for this question is option number 1, or client with an amputated leg. If he or she is not treated, the patient may go under heavy blood loss and shock. Similarly, patients with open fracture come under second priority or urgent priority, and patient with laceration of the palm and close fracture falls in third or non-urgent priority.